Good morning, guys. My name's Jackie and I'm one of the current psychiatry interns, and I was just going to show you guys a quick day in the life video of being a psychiatry intern on the inpatient psychiatry unit. So the first thing you do in the morning here, so I'm just making my coffee right now, and currently we have to all check our temperatures before we go to work. So we're all given a thermometer. You have to check your temperature real quick and enter it into the hospital COVID symptom checker with any symptoms you feel like you might be having. So after we do that and we grab our coffee, we're all ready to go. So we parked down there kind of behind where the helipad is, and then if you were to kind of walk down these buildings, you find yourself at the behavioral health unit. So we've just come through the door. So you come in the morning, you can grab a mask behind the desk here, and then behind this wall is the resident room. And then if you were to walk down this way, this takes you back. Here's where the triage office is. So when you get referrals from other hospitals, or they're trying to get direct admits or move people from the ED to the psych unit, or from other floors to the psych unit, we kind of coordinate with triage. And then if you go this way, back here, so this room is where we do morning sign out. So now I'm sitting in the conference room back here. I'm gonna swivel around. So this is where we get morning sign out in the morning. And so this is when one of the night float residents, so night float is either a second year or third year, and they come down around 7:30 and they tell us any updates from overnight, any unit issues that happened, any new patients that have been added to our teams, and then any referrals that they might have accepted from other hospitals that could be coming later in the day. So they give us a full update about everything that went on overnight, and then the day team takes over from there. So this is our little resident room. So you can come in, do notes here, print off your patient list. You can throw your stuff in these cubbies up here. And so there's a few computers. You can bring your own laptop and get Epic on your computer. And then if you go out that door, that takes you out to the unit. Alrighty, so now I'm in the resident room. And so the resident room is where we come in the morning, usually start to do some pre-charting. So I usually log onto the computer. We use Epic as our EHR, and I'll check the list to see if there's any new patients on my team, and then do some pre-charting on the patients that I'm following. And so then after that, I usually go and pre-round on my patients. So check in to see, how everyone's doing, how their mood's doing, if they feel like their medication is working or they're having any side effects. So they're all things that we discuss with the patients. And then later in the day, usually round on the whole team with your attending as well. And so then on Monday, Wednesday, and Friday, we have treatment teams. So treatment team is when we meet, it's the residents, the attending, we meet with pharmacy, nursing staff, occupational therapy, recreational therapy, and social work. Everyone kind of comes together to talk about the plan for each patient. And so we basically run the list in a biopsychosocial kind of way to talk through all of the ways that we're addressing the problems for each patient and how we can help, and when we think they'll be ready for discharge. So now that we've got our mask on, we're ready to go out to the unit and see some patients. So unfortunately, due to HIPAA stuff, won't be able to show you guys the unit, but this is the resident room, and you can get to the unit through the resident room as well. So I currently have the resident room to myself because tonight I'm on a short call. So short call is a term that we use. So during intern year, you might be on a short call, which means that you stay a little bit later. So a normal day for us is from 7:30 when you get morning sign out until 4:30. So really not that late, but about once a week when you're on the unit, you will be short call. And so when you're short call, you stay until about 9 o'clock, and there's a few things that you help do. So when you're short call, you help take care of any unit issues that come up overnight. You also manage any direct admits. So if a patient comes from an outside hospital, then you would do their H&P and any legal paperwork that needs to get done when they arrive, and any admission orders that need to be put in. You might also be putting in admission orders for any patients that arrive from other parts of the hospital if they were to transfer down to the behavioral health unit. If there are no direct admits, then you can go to the ED and help one of the second year ED psychiatry residents and try to see a patient down in the ED. What else? Oh, so we also manage the pager at night. So we all have our own pager, and when you're on short call, any pages to the outpatient clinic go to your pager. So you might help do refills, or if anyone thinks they're having any medication side effects, or if anyone is in crisis, feeling suicidal, they need someone to talk to, you manage the pager at night as well. So those are some of the things that you get to do when you're on short call. And then you staff any events that happen with the night float attending, and send out a sign out email to everyone that's covering the unit. And so then you're basically helping the ED resident and then the night float resident. You kind of bridge for when night float comes on as well. So far, I'm on short call. There haven't been any new direct admissions or pages that have come through. So we're gonna head down to the ED and see if we can help out at all. So I just stopped by and checked with triage on my way out. So far, no new referrals right now. So I'm gonna keep walking down towards the ED. And just as a note, we do tend to get a lot of referrals from outside hospitals. Vidant Medical Center is one of the largest hospitals kind of in eastern North Carolina. So we do get a lot of referrals. And what's also cool is, so even a regular adult psych unit, we have a med psych unit for patients that have more complicated issues with diabetes, or if they're getting hemodialysis. We also have an acute psychiatry unit, so we have a few beds there for patients that require more acute care. And we also have a DD unit, which is for patients with dual diagnosis, if they have a mental health disorder as well as an intellectual disability. So we are able to cover a wide range of patients, which is pretty cool. Okay guys, so it's the end of another day, but I hope you enjoyed this video of a day in the life being an ECU psychiatry intern here at Vidant Medical Center. Bye.